Today, I'm honored to be speaking with Dr. Agarwal, a board certified cardiologist with decades of experience in internal medicine and interventional cardiology. From earning his MBBS and MD in India to practicing across the US in Maryland, NC, and even at a military hospital, Dr. Agarwal has seen firsthand how medicine and tech has evolved over the years. Now retired from full time practice, he continues to give back as a volunteer physician and board time member at NCIAP People's Medical Care in Raleigh, NC. With his experience in patient care and medicine, he offers a unique perspective in how science and technology come together in healthcare. Let's get started.
Go ahead.
So to begin, I'd love to learn about your early journey. So growing up in India, what experiences or influences sparked your interest in pursuing a career in medicine?
I was born in a small town with a population of about 200,000, and I finished my high school on a regular basis. And while I was in first year of college, and we have 10 years of high school and 2 years of college, somehow my father came to know that there will be a new second medical school in Bikaner, where I was born, in addition to only one existing medical school in Jaipur, Rajasthan, who were taking only 80 students throughout the state of Rajasthan. So my father told me that you have to become a doctor because I can't afford to send you outside. I don't have that much money. And we are five brothers and four sisters. So nine siblings growing up. My father was a bank employee, assistant manager in a private bank, so he could not really afford so much money for sending me to medical school outside Bikaner. With that idea, I finished my college, and I was every day reminded only one thing from my parents, or my father: you have to become a doctor. So after finishing second year of college, I decided that I should become an engineer. So there was a little bit of struggle because the Bikaner Medical College, which was supposed to be started in 1958, when I finished my college, there was no medical school in Bikaner that year. It was supposed to come a year later. So question was whether I should wait for one more year and join Bikaner Medical College, or I should go to Jaipur, the only medical school who will take 80 students out of thousands of students in Rajasthan. Question came to the money. And I said, listen, you please let me go to medical school and I will somehow manage in 200 rupees per minute, which is equivalent to like $4 or $5. And everybody else who suggested that don't waste his 1 year if he goes to engineering college, or there was a veterinary college in my hometown, Bikaner. And somebody suggested that instead of becoming a doctor, you can become a veterinary doctor. Go ahead and apply for veterinary college. And everybody in veterinary college was surprised when they saw my mark sheet and say, you must be out of your mind. Why you want to come to veterinary college? All right. Anyway, somehow that was resolved. In 1958, I went to Jaipur and finished my medical school in 1963 with four younger brothers, two younger sisters, and two older sisters who were married when I finished my MBBS. Same question arose: should I go for MD or go ahead and start earning, join the government service? And I was very resistant. I was like first five students in the whole college. So my admission to medical college for MD was almost guaranteed. But my father said, listen, I want you to go ahead and join the service. Don't go for MD. There is no need, this and that. Somehow my luck, I got into MD program and I told my dad that, listen, I will carry on with whatever I get. So surprisingly that time, first year resident used to get 100 rupees per month. So I need to manage myself for 100 rupees per month, which was okay because dorm was provided by the medical school. and you are so busy, like 18 hours a day work from 6 in the morning, 8 or 10 o'clock in the evening. So there is hardly any time to spend any money. So with the dorm free and 100 rupees per month, I was able to pull on, and I finished my MD in 3 years. The last year of MD, there was a chance that I have to join a job because there were no money paid in the last year. Somehow, with my excellent mark sheet and performance, Government of India chose me as one of the recipient of Director General Health Service from New Delhi will pay me 200 rupees per month. I was so happy. 200 rupees per month, no work except study, study, study. And somehow I pulled through MD. So that's my briefly history. Why I became a doctor? There were only two choices. When I finished my high school or intermediate, that time in India, there were only choice. Either you become doctor or you become engineer. And becoming a lawyer, becoming a professor or teacher was way down in the list. So out of the two, engineer and doctor, with the option that there will be a medical school in hometown, so my expenses will be reduced to literally zero because I can live home and commute every day, morning, evening. And that was main reason for me becoming a physician. Okay, go ahead.
That's really inspiring. You, I was curious since you did like you've obviously finished your education and did a good amount of your career in India. What motivated you to come to America?
All right, after my MD, I joined the government of Rajasthan service and I was on the teaching staff of medical school in Bikaner. And that time there was another medical school in Udaipur. So now there are three medical schools, one in Jaipur, the oldest one, started in 1947, Bikaner 1959, and Udaipur, I think, somewhere in 62 or 63. So after joining the medical school as a lecturer in medicine, I was transferred from Bikaner to Udaipur, Udaipur to Jaipur, and my wife, who happens to be a pediatrician, same time, she was posted in Jaipur, I was posted in Udaipur, or she was posted in Bikaner, I was in Jaipur. So after 4 or 5 years of this struggle, where each one of us in a different town, I decided, entire life will be like this. They will never allow me or allow both of us to be at the same place. Luckily, I had passed my ECFMG, which was the examination for coming to this country in 1964, soon after my MBBS, while I was preparing for MD. Everybody that time suggested that why you want to go to USA? You get your MD here and you will have progress and this and that. And they discouraged me. So after 66, when I had my MD and this frequent transfer, both of us at a separate place, I decided that's enough. Let's go to United States. So that was the main reason, blessing in disguise. If they did not kept us separately, probably I would have been there and would have done that. The other reason was I wanted to excel my knowledge. So simple MD. So I thought that I'll go to USA, acquire some knowledge, at the same time acquire some money for the progress of the family. So that was the reason I came here. And briefly, I came here with a slate completely wiped out. My MBBS, MD, and all those things were not counted. And I started as an intern. So I did my internship, 2 years of medicine residency, and 2 years of cardiology fellowship. By 1974, I was ready to start my practice. I already had internal medicine board as well as license to practice in the state of New York and Maryland. And that's how I started my private practice in 1974 in a small town, Salisbury, Maryland. And I think I was amongst the only 50 physicians on the staff of that hospital. I practiced there internal medicine and cardiology for 31 years. In 2005, I moved to Asheville, North Carolina, in a VA hospital where there is no night call and no weekend call. By that time, on the medical staff of PRMC, Salisbury was like 200, 250 physicians. So I can see in 31 years when there were less than 50 physicians on the staff, and before I left after 31 years, 250. And luckily, the Salisbury, Maryland hospital was a quote unquote unique hospital. There was no other hospital as good as hospital in Salisbury. We were doing cardiac cath, open heart surgery, angioplasty, everything was there. So, and over the number of years, all small hospitals around Salisbury also had a cardiac cath lab. So one time we were doing 5,000 cardiac cath per year. The present number, I am told, is about 700-800 cardiac cath. So imagine number of people increasing, staff members increasing, and procedures decreasing because of restrictions, money, and so many other things. Alrighty, go to next one.
So I was curious. There's a lot of fields in the like medicine and healthcare. So what motivated you to go to cardiology specifically?
From very beginning, I was interested in cardiology because I saw two things. One, the knowledge was expanding very fast. There was no cardiac cath when I did my MD. Even in Salisbury, Maryland, we were not doing cardiac cath. Subsequently, CT scan, cardiac cath, everything. And also, I believe that practice of medicine procedures satisfy you as well as the patient. For example, a patient coming with heart attack, I take him to the cath lab, open the closed artery, I prevent the damage to the heart, and the family and my happiness when I go and reveal this information to the family that the blocked artery has been opened. So that was my interest in cardiology, and I wanted to pursue that while here.
So you mentioned that you worked at different hospitals. So how did that, how did your experience and like patient care differ across these hospitals?
Yeah. In Salisbury, Maryland, which was a community hospital, we were so many physicians. I think by the time peak, we were like 12 or 14 cardiologists. So competition was there. But I did my share. I was single from 1974 to 1980. Then I took a partner. So two of us practiced for another 10 years. 1990, we took a third partner. Now we three are sharing night calls, weekend calls, and one of us going back home in India for 4 weeks, the other two can handle. When we were only two physicians, it was very difficult because either you cover the hospital or you cover the office, and you cannot neglect any one of them. Office overhead is so much. Literally, our office overhead about $10,000 to $15,000 per month. So if you don't see patients, very soon you will be close to bankruptcy. So between two of us, one will manage the office, the other one will take care of all the procedures and patient care. So that was easy, and with three, it became much more busy. But after 31 years of night call, weekend call, emergency call, I realized that I need some rest, what we call as a burnout, because every third night you are on call, every third weekend you are on call, in between also you are on call. So I requested my other two partners that I be relieved from emergency room call as well as night call and weekend call. That was not acceptable to them because then they say, oh, we will be on call every other night. And I told them, listen, I've been done 31 years of night call, and I did alone for 10 years. Single guy, no partner. And then another 10 years we were doing alternate. So what is the problem? You people are younger than me, and you can do every other day, and I will also help them in managing office, i.e., I will only do office practice. You two take care of the hospital. That was not acceptable. And exactly same time, with my good luck, Ash, Asheville Salisbury VA offered me a job where no night call, no weekend call, and no management headache. And I decided to leave Salisbury after 31 years, which was very difficult, but I did it. I came to Asheville. I was just doing nothing but cardiac cath, angioplasty, and follow up patient. No clinic, no night call, no weekend call. So that was a blessing. After 10 years, I also felt by this time I was about 70. So I said, I don't want to work full time. I would like to work only 3 days a week. And Asheville VA hospital did not accept that. They said, no, we need you here more than 3 days. And then I decided, let me sit home and take it easy. We went to India for 6 months or 4 months, came back and was sitting home, and suddenly I get a call from Air Force Hospital in Las Vegas. They needed a guy like me who can do angioplasty, cardiac cath, and everything, because they were only doing cardiac cath, and all their angioplasty was sent to community hospital. So I went there. I set up a new cath lab from scratch. They bought the cath lab X-ray machine and all the equipment and all kind of catheters and everything. So I started doing cath and angioplasty at Nellis Air Force Hospital, and I did it for 3 years. And that time, my son was blessed with twin, and he was in San Francisco. So he said, Dad and Mom, both of you are now kind of retired. Come here and help. So we moved to San Francisco and stayed there for about 5 years. Even there, I was working in a community hospital, San Mateo, California, and I worked there for 5 years, and then I finally decided to retire and come back to either Asheville or here, or go back to Salisbury. Going back to Salisbury was not an option. I built a house in Asheville. We loved the house, but there was no community, no other Indian activities. And I have a younger brother who is a dentist. His son is a dentist, and I decided to move to Raleigh. So we moved here in 2018, and I started working once a week at NCIAP, People's Medical Care, 4 hours a day. Every Friday I will go there between 12 and 1 and stay there until 5 o'clock. So initially we were working in only one clinic in Creedmoor. Subsequently, they opened a clinic in Apex and asked me to run that clinic and take care. So I exclusively ran the Apex clinic. However, there were other 2, 3 physicians and one nurse practitioner who will work 5 days a week, because I was still working only one day a week, every Friday in the afternoon. So that's my
Wow.
brief.
You worked so many places. It's so cool. Like you've been everywhere basically.
Yeah,
Um,
in India, working as a physician was entirely different. It was like a quote unquote physician is like a god. You go there, you see patients, come home, take siesta, lunch, go in the evening, and again make round. And being lecturer, there were residents, interns, and other physicians who will take care of everything. You just supervise and make sure. Coming here, first 3 years were very difficult, because going through training, you are at the lowest edge end of totem. Everything you have to do: carry the patient to X-ray, draw the blood, take him to this place, that place, and of course a little bit of training. So after 3.5 years of medicine, cardiology training was good. I did my Maimonides in a hospital in Brooklyn, Maimonides, who were doing everything: cath, Of course, the angioplasty was not invented. Um, so it was a very different experience. Working like a god, working like the fourth class servant, you know, doing all this cut work, drawing blood, carrying patient, carrying this stuff, that stuff, training, learning the cat was a good experience. And subsequently, I really enjoyed practice in Salisbury, Maryland. Small town. I used to live less than a mile away from hospital. So middle of the night, somebody comes to the emergency room. They call me. I go and see the patient in the emergency room, take care of and come back and sleep. So it was a very different experience. In VA hospital, it was a luxury. It was like 9 to 5 job. You reach there at 9, finish at 5, come home Friday evening, and you don't go until Monday morning. That was luxury. Working in Nellis Air Force Hospital was an entirely different experience. What kind of security they had. I will go there every day. Still, they will stop my car. Somebody will go around the car, make sure something, and ask me to pull the window, look at me, look at other things, and then they. And I had a pass which allowed me to enter the hospital. After going to the hospital as a cardiologist, I was amazed security at Air Force Hospital. I was only allowed to go where a cardiology is needed, like intensive care unit, X-ray department, or some other. If I want to go to another department, the door will not open with my fob. Then I requested them, listen, sometimes I have to go to the lab to see this. They say, okay, we'll give you permission now. So they added a few other places where my fob will work. So I was kind of impressed by the amount of security. At 5 o'clock, there will be a siren, and because it was a Air Force hospital, you will see a lot of aeroplanes in the air doing all kind of gimmicks. It was experience, but it was very, very hot, 120 degrees during summer. So by the time you finish hospital, you can hardly put your hand on steering because it is like a hot rod. So you wait for a few minutes until it comes. We enjoyed the stay in Las Vegas. It was nice. Of course, I never visited all these other things. I'll come home and then we and my wife will enjoy. We had good company there. There was a Indian temple. We'll go every weekend. And it was nice, very nice, nice. We both enjoyed the stay, but we could not stay there for permanently. I will not suggest anybody, physician, to stay in Las Vegas unless he is very much interested in gambling and other things, which I was not. Hardly visited casinos, maybe 2, 3 times, or whenever a guest came, I'll take them to show the. And I used to drive from home to Nellis Air Force Hospital on boulevard, which is full of all these casinos on both sides of the road. So it was a different experience. After that, San Francisco was. I used to work in a integrated clinic where you see the patient and you provide all kind of care, the cardiac care, internal medicine care, family medicine care, everything is provided. And most of these patients were Medicaid patients or poor patients who could not afford. But it was a very nicely arranged clinic. You go there, you see your patients and come out, and that's it. There is no night call, no weekend call. Nobody calls you until next day. So it was another experience. And after coming here, I am really enjoying working at People's Medical Care. I go there, everybody is very respectful. Patients feel so happy that they can see a physician for $55. The same patient goes to emergency room or any other private practitioner, bill is going to be $1,000. So we provide a really not entirely free but subsidized care. So half of the money is collected from the patients, other half comes from donations. And I myself donate $3,000 every year to NCIAP in this good work. And I feel that I'm returning what the community gave me let me provide this service for them. Okay, next.
Um, so since you work at NCIA People's Medical Care, I've read a lot about like people getting unfair, like not the healthcare that they need. So why do you think and how do you think we can solve that? Is there a way to solve it?
It is a very difficult problem. I don't think there is an easy answer. And by practicing in India, by practicing in BA hospital, in Air Force hospital, my conclusion is that basic medical care should be provided by the government. See, if you have a simple and complicated, you can have insurance, otherwise you pay from pocket. Just like in England, they say that. Now what we do is, if a very complex patient comes who cannot be handled by us, an example, elderly patient visiting from India developed a complete heart block and he needed a pacemaker. He came to our clinic. I immediately made the diagnosis, did an electrocardiogram, which we can do in clinic, and right away called the emergency room of Wake Med Hospital that I have a 78-year-old who needs pacemaker. He was transferred to, actually the doctor carried him to Wake Med, which is not far away. And I'm so happy that Wake Med right away, next day he had a permanent pacemaker. He was doing well. He came back to me and was so thankful. The daughter was also very, very thankful. The doctor, if you didn't make this diagnosis, my dad will never be able to go back to India. And he's so happy. He was, of course, he went back to India. So what we do in people's medical care is like one-time visit. All these parents and elderly people come from India, don't have money, and nowadays they are very smart. They bring list of medicine, they carry 6 months supply of medicine, but still then an acute illness we can take care and we can adjust their medicine and can do basic blood tests and help them. However, we are not geared and neither we can provide extensive medical care. For extensive medical care, they have to go to the urgent care or urgent center, which hurts me because once a patient goes to urgent care and urgent or emergency room, you're talking of bill in $1,000, thousands of dollars, 5,000, $10,000. So how we can resolve it? Basic medical care should be provided to everybody. And if there is a complicated, then you have a secondary insurance which will take care. Like even I get sick, you know what will happen? I have a private physician will tell me, go to the emergency room or go to the urgent care because there is nothing like you can call. While I was practicing, if a patient called me, my patient, of course, who being followed in the office, I'll say, come to the emergency room, I'll come and see you there. See the difference? Because there I was responsible for the medical care. Here I am only providing part of the medical care. They have to go to urgent care because urgent care and emergency room will not allow me to go and see the patient there. I don't have privileges. So all these things are very complex, and it was simple. Health insurance and health human services would have resolved it. A lot of politics, a lot of money, a lot of other things, and we are happy that at least we can provide same day care. That patient with heart block would have been dead by the time he reached emergency room, or somebody has to make a diagnosis. So daughter was so thankful that, listen, if you did not exist here, I don't think we would have immediate diagnosis, immediately sent to the, and daughter carried him in car and he made it. Similarly, there are some other examples where very acutely ill patient ends up in our clinic. We right away send them to emergency room. So it's a very difficult. Your question was, in my opinion, what can be done? I don't think it's something very simple. A lot of money, a lot of politics, a lot of this thing. They need to resolve this thing. Basic care should be provided to everybody, and complicated care, health insurance. All right. Next.
I was also wanted to ask you. I know there's been a lot of like medical and STEM related advances in technology, like AI and like CRISPR and all that stuff that really help with medicine and healthcare. So, do you think that's made a difference in helping underrepresented minority people get the treatment that they need, or has it made it worse?
I think it is too early to say that. Yes, AI will help, but question is AI is also not 100% correct. Sometimes AI be false information or wrong information. So as far as patient care is involved, no, right now we are not taking any help from AI. But as far as paperwork, dictation, it has definitely helped the provider by giving easy. For example, I don't have to go and dictate the complete thing, few items, and AI will create a visit. Presently, in our people's medical care, we have both options. Either you can dictate the whole note. If you dictate, somebody has to transcribe it, and we can't afford. Or handwrite and scan and put into the electronic chart. So I think very soon AI will come up with a simple software or something where I can pick up phone and dictate salient features, and AI will convert that into paragraph and make a nice looking. See, the aim of providing these notes and all these things is not for the patient care, but next time patient comes and another physician is seeing him, if he doesn't know what was done, so we have to document everything in a palatable form. So when I write a progress note, I mention there why patient is here today, what was the last time he came here for, what was his weight, what was his blood pressure, what was his pulse, what is now, and then I from head to toe, we use the word SOAP. S means subjective, what patient is complaining of. O is objective, what my findings are. A is assessment, what my assessment shows me, and P is what is the recommendation or what do I suggest. So if we form this standardized so progress note, everything is covered. What patient complaining of, what my findings are, what is my assessment and investigations I want, and what I can provide. So I think AI will be very helpful. At present, it is kind of expensive for everybody to take use, and what we are doing is, we just cannot afford more expensive expenses at the office, so we are trying to do that. And I think somebody came in last week and explained me you know how to write the progress note briefly within few minutes. You can have a nicely written. So yes, AI and advancement, unbelievable advancement. 1969 I came to this country. In entire New York City, only few hospitals were doing cardiac cath. Cardiac cath was not a common procedure. Other procedure like echocardiogram, today almost everybody has the facility. In New York City, only one echo machine was in Columbia Hospital. Only one machine in entire New York. The hospital where I was doing cardiology fellowship did not have echo machine. But today, echo machine is everywhere. So there has been, and then a lot of fine further improvement. The outcome of those things in general practice will take years. Something is invented today, initially it goes through trial, then a lot of people start using it. In the beginning, everybody say, no, it is not true. Then they say, yeah, it is good. And then after a few years, there is nothing new because it has been there. So this is how a new research or new procedure goes through. And yes, definitely significant, very important improvements, but that kind of care is very expensive. available only in university hospitals or teaching hospitals or some other good. Our hospitals like Duke has everything, but Wake Med and the other one, Rex Hospital, also has everything which is being used. So yes, there is proliferation of research which have come into the common use. Whether it is available to every patient, no, not yet. Patient come to me in people medical care, and I said, listen, you have diabetes, you need blood sugar and this test. Well, doctor, I have only $55. Either I can see you or I can have blood test. Maybe next time. So, I mean, I'm trying to show how important it is. If you don't have money, you cannot have blood test. If you don't have money, you cannot have X-ray. So things will improve. Yes, they will. They will. And half of our expenses at NCIAP come from donations, and donations vary from few thousand to 100,000. There are one or two guys who will donate 100,000 every year, or at least last year somebody donated 100,000. So this is how it is with donations and people who are providing their service free. We should be able to provide better service to some of our patients. Okay. Anything else?
Um, I think I have one final question, if that's okay.
Yeah, sure.
So, what's one piece of advice you'd give to people who want to get into healthcare right now? And what skills should they focus on to prepare for that?
Absolutely. I have three, four students at different time shadowing me in the people's medical care, and I know three of them got into medical school not because they were coming to people's medical care. They were hardworking, very attentive. They will watch everything, and they had to have an excellent score in MCAT. So my advice to younger people is, yes, medical field or healthcare is very important, but don't go into it thinking that I'm going to make a lot of money. Yes, you will make significantly large amount of money, but it involves a lot of personal efforts. Being on call 24 hours a day, every weekday, weekend, unless you share, that's not everybody wants to do. I know we are the first generation. You people will be second generation. I know of a lot of second generation who had excellent MCAT score. They don't want to become a doctor. I said, why? Well, listen, uncle, I go to medical school, 5 year of medical school, 3 years of training, then 5 years of training. So I'll become a doctor making money 10 years, 11 years from now. On the other hand, my other fellows start making money now. So I went into stock market or whatever. Money, he became accounting and this and that, and he is already a millionaire. So why should I go into medical? No, you go to medical school with the idea you're going to work hard and you will be rewarded for your hard work. And be prepared to go into this for a long term. You're not going to become a doctor today, start making money tomorrow, and you'll be rich. No. You go to medical school, work hard, excel, choose the branch which you want. Like, I could have become a surgeon, but I was turned off. Surgeon's life is, oh my God, they are operating for 12 hours, 14 hours. I said, no, no, no. In cardiac cath, I can do the procedure in half an hour. My longest procedure will be 2 hours. On the other hand, there are some branches. So think about what you want to do, how you want to serve the people. I work in people's medical care not as a cardiologist. I'm an interventional cardiologist, but I am doing a medical care. If the patient comes with high blood pressure, I can manage his blood pressure, diabetes, obesity, hyperlipidemia, high cholesterol, healthy eating. So, yes, you can provide medical care to a lot of people, and you should be prepared to. I don't see a reason becoming a doctor. Oh, I'm an orthopedic doctor, but I only do hip joint. I am not going to do knee joint or ankle joint or elbow or shoulder. Yes, you can survive in a Duke University or Mayo Clinic, but if you only want to do hip, you better think about it. Then you have to. So there are two options: good medical care to everybody, very specialized focus care to few people. It's up to you what you want to do. So I became a physician. I don't mind taking care of anything which I am capable of. I can say, listen, I'm a cardiologist, only do cardiac cath. No, you have to be prepared. So to younger people, all these people who are shadowing me all the time, only thing which they hear from me is one of them is going to undergrad, and I am 100% sure that he will get into medical school because he's a hardworking, very punctual, come in time, and will not go until I tell him to go. On the other hand, there are few who come, oh, I will be late 1 hour, and then he says, oh, I have to go now. So go ahead. I mean, you're not compulsory. So I think hard work and study. So this guy who is in undergrad program, I always tell him only one thing: focus on study. Focus on study. Forget about other things. Well, uncle, then I don't have a life. I said, listen, there is plenty of life afterwards. Once you get into medical school, you can take your time. So that's what I advise. So there one of them who went into uh, 8 year program, undergrad and medical school in 8 years. One who went to, I think, 7 year program. Other one is going to regular medical school, good MCAT score. And there are two, three other guys who come there. So I would suggest to a young person who is in college and want to know what a medicine and what a practice of medicine is, go and work with the physician for few weeks and then develop your taste. Is that what you want to do? And then you choose the branch where you are most interested. Okay? Thank you so much. Anything else?
Yeah. Yeah, that's it for today.